Today's class is on vertical dimension. The objectives of determining vertical dimension is to maintain aesthetic harmony of face, to satisfy functional requirements, to speak without teeth contacts, to enhance masticatory efficiency, and to provide comfort to temporomandibular joint and masticatory apparatus with alveolar ridge. What is vertical dimension at rest? It is the postural jaw position when the patient is resting comfortably in an upright position and when the condyles are in neutral, unstrained positions in the glenoid fossa. Vertical dimension at occlusion is the distance between two selected anatomic or marked point, usually one on the tip of the nose and the other on the prominence of the chin when in maximal intercuspal position. Freeway space is the space between the two occluding surfaces of the upper and the lower teeth when the mandible is in physiologic rest position. It is usually within an average of 2 to 4 millimeters. Vertical relation is classified based on the mechanical methods and physiological methods of recording. Coming on to the various methods which are used for establishment of vertical dimension, under mechanical methods we have ridge relation, measurement of old dentures, facial measurements and pre-extraction records. Under physiologic method we have physiologic rest position, phonetics, aesthetics, swallowing threshold, Silverman's closest speaking space, tactile sensation, electromyography and Niswonger's method. Moving on to the first category of determination, that is mechanical methods, we have ridge relation. Here the distance is estimated from the incisive papilla to the mandibular incisors, or even parallelism of the ridges can be used to identify the vertical dimension. Apart from that, even the presence of old dentures can be used for rough estimation of vertical dimension. The facial measurements and pre-extraction records are also coming under the category of mechanical methods of VD estimation. Moving on to the first technique in detail, the incisal edge of mandibular central incisor is at an average of 6 millimeters, and for the mandibular incisors it is about 4 millimeters. This average vertical overlap of opposing incisors is about 2 millimeters. So this details are used for correlating the vertical dimension in edentulous patients, but the disadvantages are there is absence of natural teeth and visualization can be difficult, and absence of lower teeth makes this treatment feasible only while fabricating single complete dentures. Moving on to parallelism of the ridges are usually parallel at an optimal condition when the vertical dimension is viewed in a sagittal plane. But however, it is not a reliable technique in many patients because they have marked amount of ridge resorption and the parallelism would have been lost. Apart from that, the teeth would have been lost at irregular intervals, making ridges less parallel. Measurement of former dentures, these are made between the borders of the maxillary and mandibular dentures by means of a Bowley's gauge. However, alterations can be made in the new prosthesis to compensate the occlusal wear. Under pre-extraction records, we have profile radiographs, profile photographs, articulated casts, face masks, profile soft tissue tracing, Willie's method and Wright's method which are used. Profile photographs are made with the teeth in maximum occlusion and enlarged to life size. Anatomic landmarks on the photographs compared with the measurements of the face can be done, but however limitations such as angulation of the photograph might differ from the patient's posture. Profile silhouettes have also been tried for estimation of the vertical dimension in edentulous patients. Articulated casts measurements can be made on the casts in occlusion, and these measurements can be used for VD determination. Willie's method uses the distance between the base of the nose to the lower third of the mandible, and this distance was supposed to be equal to the distance between the pupil of the eyes and the rima oris. So this eye, lip, nose, chin method can be used for determination of vertical dimension. Wright's method employed interpupillary distance and brow-chin distance, and then he calculated interpupillary distance on the photo and multiplied it with that on the patient for estimation of the brow-chin distance on the photo and brow-chin distance on the patient. Under physiologic rest method, we have these many list of techniques. Physiological rest position after insertion of the occlusal rims into the patient's mouth, the patient is asked to say swallow and gently relax. Then the lips are carefully separated to see how much of space exists between the occlusal rims. The patient is asked to repeatedly say letters such as F or V or M until their awareness of the lips contact is obtained. The patient is asked to stop all jaw movements when the lips touch and the distance between the 2 points of reference are measured. Under swallowing threshold, which was suggested by Shanahan, the position of the mandible at the beginning of the swallowing act has been used as a guide for determining vertical dimension. Silverman was the person who suggested the technique of use of closest speaking space, which determines the vertical relation in phonetic method. Now, this space measures the vertical relation when the mandible and the muscles involved are in physiologic rest position. It determines the centric occlusal line. For this technique, the centric occlusal line is marked. The closest speaking line is marked by asking the patient to pronounce sibilant sounds like S. The height is adjusted until a minimum of space exists when the patient pronounces the letter S. It may vary from 1 to 10 mm, but usually 2 mm average is generally done to prevent an increase in vertical dimension. Tactile sensation is also another method for determining vertical dimension with the use of occlusal rims in place, and the patient is asked a Bose bimeter is attached for determining the neuromuscular coordination, and the patient is asked to open and close until there is any fatigue which the patient experiences. This is an instrument capable of recording the muscle forces at different height. The patient is asked to bite with the instrument in the position which receive the maximum force. This is called as Bose bimeter or power point. Electromyography determines the rest position of the mandible by means of EMG, which records the activity of the muscles. And however, this is not a practical method of determining the vertical dimension in daily clinical setup. This instrument is quite expensive and it becomes impractical for daily usage. TENS is transcutaneous electrical neural stimulation, utilizes devices like BioTens or myomonitor to relax the muscles. The device delivers a mild electrical impulse to the muscles that moves the jaws. In few minutes, the muscles relax and aids in determination of the optimal position. Niswonger's method is the most commonly employed method which determines the vertical dimension at rest. At occlusion, the difference between VDO and VDR is 2 to 4 mm, that is the freeway space. For this method, you have to insert the maxillary occlusal rim, adjust the labial and labial support, reduce or add maxillary anterior plane of occlusion to 2 mm of lower border of upper lip, orient the posterior plane to L tragus line, measure the vertical dimension at rest with two most prominent positions, one in the maxilla, which is the tip of the nose, and the other in the mandible, which is the prominence of the chin. Insert the mandibular occlusal rim, measure the vertical dimension at occlusion. The difference should be 2 to 4 mm. Either add or reduce to obtain the same.